I do want to bring in right now Republican Congressman Tom Reed of New York. Congressman, good to see you.
Good to see you. Thanks for having me on.
Yeah, we were just talking about Senator Chuck Schumer, who seems to be willing to reach out across the aisle. He wants to actually come back and renegotiate. He admits that there's problems with Obamacare. Politically, do you believe the Democrats when they say they do want to work with the GOP to fix health care at some point?
I hope so. I mean, obviously, the collapse of the individual markets is something that we should all be concerned about as elected officials representing people across America. We've been working as a group across the aisle with about 40 members of Congress that said, you know, if the Senate can't act, can we come up with some solutions to the individual market? I think there's a sweet spot there, and I encourage the senators to continue to have those conversations because we'll have them in the House.
Okay, so one of the things that Paul Ryan had promised was that he would take this back to reconciliation. He wasn't going to just shoot it right to the president's desk, but that wasn't enough for Senator John McCain of Arizona. Were you disappointed in Senator McCain?
Well, I'm not disappointed just in Senator McCain, just disappointed that the Senate couldn't act is more my appropriate expression, because we're talking about people. We're talking about real people that are impacted by the collapsing markets as we speak. We need to move the ball forward, and I'm going to do my part in the House to be part of that effort to solve these problems for America.
But the problem seems to be that everything that the GOP came up with over the last 4 months didn't do anything to address cost control, frankly. And it also, you know, you saw this expansion in 31 states of Medicaid. It was more money being spent. And the fiscal conservative in many people says, wait a minute, that's not what we want to see. We don't want to see more tax dollars supporting health care. We want to see this make sense.
Yeah, no, I agree, but given the nature of the inside D.C. budget rules that we were dealing with, it was limited as to what we could get into to health care. We always had that second and third bucket, if you recall. We were going to have additional conversations about how we could address health care on a bipartisan basis, because that's going to take 60 votes in the Senate. So bottom line is, from the American people's perspective, not doing anything, failing in the Senate is not something that's acceptable going forward.
Well, it was a pretty ugly show overnight out of the Senate. But do you think that Senate Majority Leader Mitch McConnell should basically fall on the sword for what happened?
I think the Senate needs to answer to the American people as to why they didn't take steps forward last night. And from my perspective, they're going to have to. You know, as the president said, you know, the individual markets are collapsing. Maybe that's the pressure that the Senate needs to feel in order for them to act. But the bottom line is, if we can do it sooner rather than later, we're preventing a lot of this pain from occurring to the real people who did nothing to cause this to happen to themselves.
Well, you're about to go on vacation. You're about to head home to your constituents in New York. It's a blue state. What do you think you're going to hear?
Well, there's a lot of passion out there. Obviously, we do town halls all the time. We're going to continue to have those hard conversations with both, because you got to listen to people and really look them in the eye and see the fear and anxiety that this is causing to them in their day-to-day lives. And hopefully other members will do that, and the senators will do that, so that when they come back to D.C., we are going to roll up our sleeves and get this done once and for all.
Please rest up. I think many Americans would like to see y'all finally get some stuff done and get some stuff signed as well, whether it's health care or tax reform. I could go on and on. Congressman, thank you for being with us. We appreciate it.
Thanks for having me on.